This model provides an overview of the COVID-19, what it is, and how it is transmitted. At the end of this model, you should be able to describe coronaviruses, describe the global and national spread of COVID-19, describe the COVID-19 incubation period and modes of transmission, describe at-risk populations, recognize and elicit the clinical signs and symptoms of COVID-19, and finally, describe the case management of patients with COVID-19. What are coronaviruses? They are a large group of medium-sized RNA viruses which belong to the family Coronaviridae. They were first identified in 1965. The name is derived from its spherical-shaped outer envelope with distinctive club-shaped spikes, giving the appearance of a crown or halo corona. There are 7 coronaviruses that are known to cause diseases in humans. 4 of these human coronaviruses cause mild diseases. These are HCoV 229E, HCoV OC43, HCoV NL63, and HCoV HKU1. The other 3 cause severe diseases and include the Severe Acute Respiratory Syndrome coronavirus, also known as SARS-CoV, which emerged in 2002 and disappeared in 2004. The Middle East Respiratory Syndrome coronavirus, also known as MERS-CoV, which emerged in 2012 and continues to circulate in camels, and the 2019 novel coronavirus SARS-CoV-2, which emerged in 2019. Where do coronaviruses come from? Coronaviruses are zoonotic. This means that they can be transferred from animals to humans. They circulate in animals such as bats, snakes, cats, and camels, and are known to cross species barriers. Most coronaviruses cause mild respiratory diseases such as the common cold and gastrointestinal diseases, while some can cause severe diseases such as the Severe Acute Respiratory Syndrome known as SARS. The novel coronaviruses, also known as SARS-CoV-2, will be explained more next. The 2019 novel coronavirus is known as the Severe Acute Respiratory Syndrome coronavirus 2, abbreviated as SARS-CoV-2, while the disease associated with the virus is known as the coronavirus disease, abbreviated as COVID-19. It is a beta coronavirus and has not been previously identified in human populations. It is similar to other coronaviruses in bats and is different from the SARS-CoV and MERS-CoV. The virus was transmitted from bats to humans through an unknown intermediary animal. Timeline of the 2019-2020 COVID-19 pandemic. On the 31st of December 2019, WHO was alerted of a cluster of pneumonia cases of unknown etiology in Wuhan City, Hubei Province in China. On the 9th of January 2020, the Chinese CDC identified a novel coronavirus from respiratory secretions of patients. On the 21st of January 2020, the virus had gone global. Over 200 cases had been reported from China, with incident cases in Thailand, Japan, Taiwan, South Korea, and the United States of America. At least 3 deaths had been reported at that time. On the 11th of February 2020, the disease was named COVID-19 and the virus was named SARS-CoV-2. Shortly after, Africa recorded its first case of COVID-19. On the 15th of February 2020, there was a confirmed COVID-19 case in Egypt. And on the 27th of February 2020, Nigeria recorded its first COVID-19 case in Lagos State. How is COVID-19 transmitted? COVID-19 can be transmitted by animal to human transmission and human to human transmission. Initial infection was from animal to human in a seafood market in Wuhan, China. All initial cases had a connection with the market. The subsequent cases had no connection with the market, and the disease was later detected in people outside the Hubei province and outside China. The incubation period for COVID-19 is about 5 to 6 days. However, it could be up to 14 days. Infections can be transmitted through symptomatic and asymptomatic patients. Human-to-human transmission can occur by inhaling droplets expelled from infected person's respiratory tract when coughing or sneezing, having contact with respiratory secretions from an infected patient, and touching surfaces contaminated with an infected patient's respiratory secretions and then touching your mouth, eyes, or nose. There are several risk factors that contribute to the spread of COVID-19. They include poor environmental conditions such as the presence of air pollutants, overcrowding, humidity, hygiene, and temperature. Lack of quality IPC measures and medical care to contain spread. For example, inadequate isolation capacity at healthcare facilities and non-availability of PPE. Host factors, for example, age, cigarette smoking, nutritional or immunity status, prior or concurrent infection with other pathogens and underlying medical conditions, and pathogenic characteristics of the virus, including modes of transmission, transmissibility, virulence factors, and microbial load or inoculum size. Who is at risk? Everyone can be infected, but severe cases of COVID-19 have been seen in the elderly and in people with prior and underlying medical conditions such as diabetes mellitus and asthma. Most deaths have also occurred in these populations. Recent studies suggest that 48% of infected patients have at least one type of comorbidity. Hypertension is the most common comorbidity that is associated with the coronavirus. Other common comorbidities include diabetes and coronary artery disease. People who are obese or smoke are also known to be at a high risk. What are the clinical signs and symptoms of COVID-19? For early or mild cases of COVID-19, symptoms include fever greater than 38 degrees Celsius, headache, dry cough, sneezing, general malaise, fatigue, shortness of breath, diarrhea, nausea, and vomiting. Most cases at this stage do not require hospitalization. For severe cases of COVID-19, symptoms include severe acute respiratory syndrome, pneumonia, bronchitis, kidney failure, and death. Severe cases will require hospitalization. In adults, the most common symptoms at presentation are cough, fever, fatigue, myalgia or arthralgia, and headache. Initial data indicates that over 80% of patients have asymptomatic to moderate disease and do recover. 15% may get severe disease including pneumonia, and about 5% become critically unwell with septic shock and/or multi-organ and respiratory failure. The case definitions for COVID-19 include suspected case, probable case, confirmed case, and contact. However, it is important to note that this is an evolving outbreak and the case definitions for COVID-19 may change. It is recommended that the NCDC website be consulted to get the latest guidelines and case definitions. A suspected case is any person, including severely ill patients, presenting with fever, cough, or difficulty in breathing, and who within 14 days before the onset of illness had any of the following exposures. 1. Symptoms with international travel. This refers to any person with acute respiratory illness or new respiratory symptoms without fever and no other explanation, and a history of travel to or residence in a country reporting COVID-19 within 14 days prior to symptom onset. 2. Symptoms with contact with a confirmed case. This refers to any person with new respiratory symptoms with or without fever, and who had contact with a confirmed or probable COVID-19 case in the last 14 days prior to symptom onset. Or 3. Acute respiratory illness in an area of moderate or high COVID-19 prevalence with no other explanation. This includes any patient with acute respiratory illness within the last 10 days, and in absence of an alternative diagnosis that explains the clinical presentation, and residing or working in the last 14 days in an area identified by NCDC as a moderate or high prevalence region. A probable case is any suspected case for whom testing for COVID-19 is indeterminate test results, or for whom testing was positive on a pan-coronavirus assay, or where samples were not collected before the demise of a suspect case. A confirmed case is any person with laboratory confirmation of SARS-CoV-2 infection with signs and symptoms or without signs and symptoms. A contact is a person who experienced any one of the following exposures during the 2 days before and the 14 days after the onset of symptoms of a probable or confirmed case. Face-to-face contact with a probable or confirmed case within 1 meter and for more than 15 minutes. Or direct physical contact with a probable or confirmed case. Or direct care for a patient with a probable or confirmed COVID-19 disease without using proper personal protective equipment. Or other situations as indicated by local risk assessments. Laboratory testing for COVID-19. Laboratory diagnosis for SARS-CoV-2 is by real-time PCR tests. Samples from respiratory materials are to be collected for laboratory testing for COVID-19. This includes nasopharyngeal and oropharyngeal swab, or wash in ambulatory patients, and sputum and or endotracheal aspirate, or bronchoalveolar lavage in patients with more severe respiratory disease. How do you manage COVID-19 or treat the virus? At the moment, there is still no treatment or vaccine for COVID-19. Clinical management of COVID-19 is guided by the general principles of management of respiratory illnesses, supportive therapy, and related to patients' symptoms. Please refer to the National Interim Guideline for Clinical Management of COVID-19. The standard recommendations for prevention of COVID-19 are to wash your hands regularly, cover your mouth and nose when coughing and sneezing, thoroughly cook meat, eggs, and other animal products, and avoid close contact with anyone showing symptoms of respiratory illness such as coughing and sneezing. A short video on the general facts on who should get tested for COVID-19 and how to get tested can be seen in the materials section for more information. Here is a recap of what has been taught so far. COVID-19 is a novel coronavirus that was first reported in Wuhan, China. It is transmitted mainly via respiratory droplets and contaminated hands. Median incubation period is about 5 to 6 days, but could range from 1 to 14 days. Symptoms are similar to the seasonal flu. There is no treatment and vaccine for COVID-19. Standard prevention measures to limit transmission of the virus include hand washing, covering mouth or nose when coughing or sneezing, thoroughly cooking food with animal products, and social distancing.